Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight. Now, South Korea has lifted all COVID-19 restrictions aside from the mask mandates as the peak of the Omicron wave now appears to be behind us.
That's right. And however, the country is still seeing relatively high daily figures. So is it too early to lift these measures, or can we safely begin transitioning into our living with COVID-19 phase? Now, for this, we are connecting with Dr. Alice Tan, internist at MizMedi Women's Hospital. And good morning to you, Dr. Tan.
Good morning.
Now, first and foremost, I guess the most important question right now is we are seeing a number go down right now dramatically compared to some of the figures that we've seen at the height of the Omicron wave. How do you assess the situation right now? Are we finally at a point where we can clearly say the worst is behind us?
Well, if we look at what happened in the UK, they definitely had what they're calling twin peaks of their Omicron wave. So they had a second surge after the first, and the second was due to the BA.2 subvariant. Here in South Korea, the BA.2 subvariant made up 41% of all sequenced cases 4 weeks ago, and the most recent figures show that it's making up 85% of our sequenced cases. And so even though the BA.2 is now definitely dominant, we have not seen over the last 4 weeks an increase in cases. Of course, the cases have been steadily decreasing. So I think that we are safe from a second BA.2 wave. However, there are two big questions. The first is, will the lifting of social distancing measures cause a second surge? And then, of course, will we be able to detect a second surge early enough, because of course our testing is now going to be limited. We have 33 million people, that's 64% of our population, who's received up to a third dose, and 16.3 million people were recently infected probably with the Omicron variant. So I think the pool of people who are open to infection in the near term is definitely much smaller, but we do have to take into account that protection from the third doses is now waning. And so there is the possibility that we may have a second wave. I don't think it'll be as large as the first wave, but this is something that we need to look out for.
And Dr. Tan, I wonder what you make of the easing of restrictions, which begins on Monday. I mean, some are concerned that it might be a bit premature, given that, there's a triple-digit death toll that we're seeing on a daily basis.
Right. So when we make a decision about lifting social distancing measures, we have to take into account the rate of hospitalizations related to the occupancy of ICUs and sub-ICUs. And we also have to take into account, of course, the transmission levels. Right now, the transmission level in our country is 270 per 100,000 population, which according to the US CDC guidelines is not a low level of transmission. However, in terms of occupancy of ICUs and sub-ICUs, they're both below 50%. And so I think in the near term, if we do experience a second surge after our first big Omicron surge, we will be able to absorb the patients that get infected. The question, of course, is, will we be able to monitor for a second surge, as I said, because testing is no longer, in terms of free testing, is not as widespread. And so we may be missing a second surge that happens.
It's one of those things where we want to stay positive now that we have some of these measures lifted, but still there are a couple of things that still linger in my mind, and I'm sure with a lot of the citizens as well. One being, of course, the XE variant that's been popping up, the other being the XL variant. Are these going to be a big concern moving forward? Because, at least according to some of the reports that are coming out right now, it's not something that we should be too worried about.
I agree with you. So if we look at the statistics from the UK, both the XE and the XL variants really didn't do much in terms of causing large numbers of cases. And so I think we don't need to worry too much about these two recombinant variants. I'm actually more concerned about BA.4 and BA.5 subvariants of Omicron because they both contain a certain mutation which may make them more transmissible. And so we are waiting for more information out of South Africa. They're looking into this. Also, the UK, they're looking into this. And so this is the reason why we need to continue with high levels of genetic surveillance in our country. We don't have any BA.4, BA.5 cases in our country yet, but it is something that we need to watch out for.
And Dr. Tan, Dr. Anthony Fauci warned that there might be a resurgence of cases in the US in the autumn. And while South Korea seems to be following the trends that the US and the UK are seeing, so should South Korea be worried as well about a possible resurgence?
Of course. So the fall winter season, of course, is when we see peaks of respiratory infectious diseases. Certainly in the Northern Hemisphere, that's when we experience the Delta wave and then the Omicron wave. And so there is a high chance that we will have another surge this winter season. But I should note that it may come earlier. We may have a surge in the summer because there are variants that are emerging all the time. If we remember in India, their biggest Delta surge occurred in the spring-summer timeframe. And so I think this is something that we need to be very, very careful about. And that's why I'm concerned about our testing. If we do not test, the data streams from our testing are not as reliable. And so it's hard for us to know what exactly is going on. But I'm glad that we do have this on the radar in terms of a next surge, emerging surge that might happen.
I think it's safe to say, I think we shouldn't be too lax, even with the measures that are being lifted soon. Dr. Tan, as always, thank you very much for your insights, and we're looking forward to talking to you again.
Thank you.